I want to introduce Dr. Gilly on PTSD. This is super exciting for me. Thank you so much, Dr. Gilly, for being on with us. Can you give our listeners and our viewers a little bit of an introduction about yourself?
Yeah, I'm so happy to be here. Thank you so much for having me today, Vanina. So my name is Dr. Gilly Kahn. I'm a clinical psychologist, a mom, and a writer. And I specialize in work with neurodivergent teens and teens who are autistic, and or have ADHD. And I just published my first book. The title is Allow Me to Interrupt. A psychologist reveals the emotional truth behind women's ADHD. And it's about the emotional dysregulation component of ADHD, particularly in women. And I am based in Atlanta, Georgia. I love living here.
I love that. How long have you been living there for?
Kind of new. We moved during the pandemic. So I've been living here like over 4 years. I'm originally from Miami, Florida, and I did all of my training in South Florida.
Nice, nice. So I was wondering, what are some of the common misconceptions and unique challenges that women in particular, mothers, and even female teens that you see that are facing ADHD?
Yeah, that's a lot of different groups.
Yes,
So
yes. So please feel free to like break it down so it makes more sense.
the main issue or obstacle that girls and women are facing, in my opinion, but I think a lot of mental health professionals would agree, is just misunderstanding how ADHD actually surfaces in females. Right now, the criteria in the Diagnostic and Statistical Manual, they were written mostly based on groups of boys, not even men, boys. There are some like parenthetical statements in the DSM attempting to kind of like tailor each criterion to an adult. Like, for example, you normally would not see an adult climbing about in situations where it's inappropriate. So that might look more like, fidgetiness or internal restlessness. The problem, though, is that the descriptions that are there right now that we use to diagnose adults with ADHD, they're not really like research backed descriptions. They were just kind of added just based on professionals, came up with them, but it wasn't really based on any research to my understanding. So the way that we are diagnosing girls and women is with these criteria that were developed on and for mostly boys. So it's like, we're going to miss a lot of the symptoms that are going to look different in girls.
Right.
Of course, so many girls are flying under the radar. The other thing is the female brain is different than the male brain, and the way that females are even socialized in society, that's different
Right.
than males. So, then the issue of masking has kind of come up, and that's something that is more, like in the media and is considered more like popular psychology. But I think that a lot of the terms that people come up with to describe their difficulties are actually really helpful, because they wouldn't come up with these terms if there wasn't any truth to it.
Right. Right. So, what do you think are some of the main challenges that you're personally seeing or that you've experienced when it comes to ADHD and trauma and women in particular?
Yeah, so recently did an episode on ADHD and trauma. There's a chapter in my book on ADHD and trauma. It's a little bit more specific to grief, because my book is like part memoir, and I lost my mom to breast cancer when I was 4. So that is kind of what I'm most familiar with just through personal experience, but I don't specialize in trauma. But of course, there's, some overlap
Yeah,
between
there's that intersection that we see at times.
trauma and ADHD. I do think it's important, though, to mention that there's, some misinformation out there about ADHD being like fully explained by trauma, but the research doesn't support that at all. They're two separate conditions, but, just like with any other diagnosis, there could be comorbidities, meaning that different disorders can sprout simultaneously.
Right.
And our challenges don't exist in a vacuum. There's going to be a lot of overlap between some conditions, but that doesn't mean that they are one and the same.
Right. Absolutely. So, can you tell me a little bit about your page? When I found you, I just absolutely loved your page. I love how transparent you are, how real you are, and how relatable. That was the biggest thing that attracted me to you. And I think that any person, particularly women that are mothers or younger women that are struggling with ADHD and trying to understand it a bit, can find your page and just feel very safe in your page and in your content. Can you tell me a little bit about what made you want to study this and create your page and make it the way that you've made it so warming and so welcoming?
Yeah. So, I'm very transparent and honest.
Mhm.
So I'll tell you, basically, I think you're referring to my Instagram page.
Yes, yes, your
Yeah,
Instagram page
just
in
to
particular.
clarify,
Yes.
I think.
Yes, just to clarify.
Yeah. And then, like, I guess, I don't know, shameless plug, or if anyone's interested, you can find me, at Dr. Gilly Kahn. But to be
Yes.
completely honest, 2 years ago, around 2 years ago, I didn't even know what a handle was. Like, people said, "Oh, what's your handle?" I was like, of a car.
Again.
Like, like, what is that? And it's because I chose to get off social media completely for several years, like everything, like about 7 years. And now Facebook, it's like we are nearing 10 years and I just got back on. But the reason I got on, well, the reason I got off, let's start with that. The
I
reason I
love
chose
that.
to get off social media was because of issues related to ADHD, but I didn't realize it was related to ADHD at the time. If you haven't heard of rejection sensitivity dysphoria yet, I feel like
I have
that's
not actually.
okay. Yeah. So I'll describe it. So rejection sensitivity dysphoria, RSD, is defined as extreme sensitivity to perceived or actual criticism. And it's a term that was popularized by a psychiatrist named Dr. William Dodson. And the reason it was, I say popularized, is because, and you can listen to some of his lectures about this on Attitude Magazine's podcast. It's called
Okay.
ADHD Experts Podcast. So that's how I started to learn about RSD, through whatever he has available online. And he started writing about it in relation to his patients who he was seeing as a psychiatrist. And he said that he noticed a pattern in that individuals with ADHD were extremely sensitive to rejection, regardless of whether it was there or not. So,
Okay.
there were times where maybe they were misperceiving rejection and their response to it was like very extreme. Like they would get very depressed, maybe have suicidal thoughts. They experience this kind of stabbing sensation in their chest, like this intense physical discomfort.
Okay. So they were having complete somatic experiences to this perceived rejection.
Yes, yeah. But the thing though that's important to keep in mind that I think a lot of people misunderstand is they'll say, well, it would have to be perceived and not necessarily there. But that's not true, because when you think about neurodiversity, we are probably one of the most rejected groups. And there's a reason for the term, neurodivergent, because we think differently. And if our brain functions differently, then naturally people aren't really going to get us.
Right.
And, there is real rejection. So it's not
Absolutely.
like all made up or in our heads or perceived.
Exactly.
But then it becomes a game of whack-a-mole because maybe our awareness is not as great. For ADHD, it's for different reasons than for autism, but I don't want to kind of go down that rabbit hole right now. But so it's sort of like a game of whack-a-mole. It's like, am I being rejected? Am I not? The last time I tried something like this, I was rejected. So is that happening now?
Right.
And then you start to kind of spiral and ruminate.
Yes.
Yeah. So in my book, I kind of dive into, in an article actually in a blog post that I had published on Attitude Magazine. I described this a little bit more in depth, but I'm interested more in like the neurological side of things. Like, why is this more apparent in women? Because now research is starting to come out on RSD, and it seems to be, a phenomenon that's maybe more relevant to ADHD in girls and women, although I've seen it in boys too. But I think it has something to do with like how sensitive you are and how much you care about social interactions.
Right. And so that brings us into the world of social media to kind of circle back. So when we are talking about your handle in particular, again, you just make it such a fun and safe space to just be extremely transparent, right? And it makes it very relatable to a lot of women. I know that when I saw your page, I was like, I love this. I love her. I don't even know her, but this is the best. So can you tell me a little bit about your personal inspiration when it comes to your posts in particular?
Yeah. So like I said, so I got off because of rejection sensitivity, because of ADHD. It's hard for me still to put down my phone. It's addictive. And I write about that too. All of that has to do with emotional dysregulation and, dopamine depletion. Like it, you know, neurologically, you're just not getting what you need. You're going to try to fill that need. And when there are things in the environment that can so easily fill the need, like social media,
Absolutely.
then you're going to be drawn to that. So I was just kind of aware and I recognized that it was a problem. And I decided to kind of cut myself off at that point. But then, I wanted to pursue my writing dreams because this is something I've wanted to do since I was 14. I said I wanted to publish a book. I wanted to be a writer. I used to write stories and read them to my friends over the phone in middle school. So it was just a goal I had when I got to college. I double majored in psychology and creative writing. And then, I just kind of put all my eggs in the psychology basket because it's time consuming to get.
I can totally relate. We're in the similar path in the sense that I got my BA in creative writing with a minor in writing. So and it has always been my dream as well. Like I've already picked the name of my book since I was like 10 years old. So I'm right there with you. But then, you kind of grow up in a sense and you're like, well, what am I going to do? Become a famous writer? Like, what are the chances, right? And you're like, let me pick something that I know I can double down on and make a career out of, right?
Exactly.
But that's so beautiful that you've been able to publish a book and many articles and also pursue that dream that you've always had.
Yeah. Yeah, I had that exact same thought process. Actually, I only started majoring in psychology and I thought I will become a psychologist. This dream is kind of a wash.
Right.
And then while I was in college, and I had like an English minor, I was like, well, let me kind of, fill my writing needs or like my love of literature like with this.
Hmm.
But then I was like, no, this is not creative writing. So I just made it a double major and I couldn't be happier. It was such a good experience to
That's amazing.
include that and to not give up on that dream. But anyway, this brings me to social media. So, I did not think like this would be a part of the equation, but like when you're studying creative writing in college, you probably know this. They don't really teach you about the process of becoming an author.
No, not
Right.
at all.
And you need to have an online presence. And I was living under a rock. Like I say, like Patrick from SpongeBob SquarePants. Like you could lift the rock and I'd be like, hello. And people used to make fun of me for it. Like I remember in the practice I was in just a few years ago, they used to be like, oh yeah, you see it on the Facebook group, but like Gilly would know because she's not on social media. But anyway, I learned I had to get on social media. I had to get on social media. I had to start like hustling and, publishing and talking and doing podcast episodes. And whereas I just honestly just wanted to live under a rock and just see people individually. But I loved writing so much that I was like, I'm going to do it. And that's how I started my page. And, you get like a lot of feedback from different people. They say, like, schedule your posts or, pre think your posts. But like, that's not very ADHD friendly. We just don't function that way. So that's very far from anything I do. It's very
Hmm.
organic. If I get inspired, I'm just like, gotta do it now. And then, I just kind of see like what the response is. If people are interested in what I have to say, then I keep the post. And if they're not interested, I remove it. But it's like a game of trial and error.
So can we talk a little bit about what that journey looked like for you when you were diagnosed at what age and what that looked like for you as a female as well as becoming a doctor and then becoming a mom on top of it?
I'm a psychologist. And before I was a psychologist, I was just interested in psychology. Like the books I read were about mental disorders or they were fiction and they just had like this kind of like psychological twist to them.
Mhm.
So I was familiar with diagnosis, but also I took AP Psych in high school. And that's kind of when I decided I wanted to be a psychologist and kind of focus on that ahead of writing. So I would say around that time or maybe a little bit after, I used to kind of suspect, I was like, I think I have ADHD, but the diagnostic criteria was not so different then. So I would try to make sense of my symptoms. Like, for example, it's always been really hard for me to sleep, like really hard. And it was very exhausting. I mean, pun intended, but emotionally exhausting. I mean,
Yeah.
because when you're not sleeping well, that affects you in so many different ways. It
It's
affects
so hard to
you,
function overall.
your productivity. There were other things I learned about, only recently that are related to ADHD. For example, you have a higher risk for suffering from migraine attacks if
Okay.
you have ADHD or, if you're neurodivergent, and that there's a big hormonal component. That's not something also that people didn't really talked about until recently, like within the past few years. Even though there was some literature on it, it just wasn't very widely discussed. There wasn't a lot of awareness. So when I was younger and I would have thoughts at night where I was just kind of like thinking about the day, ruminating about something that happened, or planning things out, or thinking, did I do this? Where did I put this? I was thinking, is this like generalized anxiety disorder? Like, am I worrying? But it didn't really seem to fit. But ADHD didn't fit either because it just wasn't described and it wasn't understood that way. So for a while, I thought maybe I had anxiety, but I wasn't really an anxious person. I was socially anxious, but that's because I think because of the rejection sensitivity and
Right.
because I said the wrong things, or sometimes even my face did the wrong things. Like there was this one situation in graduate school where I like rolled my eyes at a professor, but I didn't mean to roll. That's just what my eyes do.
Okay.
But I think that's a big piece of it. Like we misunderstand ourselves and other people misunderstand us. And I think the understanding of ADHD based on the criteria is the reason for that.
Yeah.
And so I thought for many years I had ADHD, but I didn't go and get diagnosed. And then I had my daughter, who's 7 now. And when she was 2, 3, my husband and I looked at each other and we were like, this girl has ADHD. But I didn't have a diagnosis. And so, he would say,
What about her made you feel that way? Made your husband feel that way? What symptoms was she
yeah.
showing?
So she never really slept well. I mean, she slept well at night, but she never napped. I mean, she was the only girl in class who was up and like having a party during nap time. And she was just, I love her and she's older now, but she was difficult emotionally, huge emotions. And I was being trained in parent-child interaction therapy. So, I saw kids who were emotionally dysregulated, and that was my daughter too. And I definitely had to use all of the PCIT skills with her.
Can I ask as a mother, because the mother component comes into with so much shame, because there's so much pressure on us as moms that I think that we set on ourselves too, of my child is so dysregulated, it must be something that I'm doing wrong. And then also as a clinician, you're like, but I have all the tools and I know all the things, right? And I feel like I'm doing my very best. Like, why is my child still struggling in these ways? Where am I going wrong? And I think that's where as mothers and as women, we really carry a lot of shame sometimes as well and a lot of fear.
Yeah. Yeah. I mean, I think for me, it was like a push pull because I'm trained in this. And at the time
Mhm.
that I had my daughter, like I was definitely trained in it. Like I was in graduate school. I had already completed a master's degree in experimental psychology. And then I entered my clinical psychology PhD program and I was already doing a practicum. So this must have been like my third or even fourth year in the program. So I was like 6 years into graduate school. So I didn't really criticize. I didn't think it was me. Like I had enough
Mhm.
awareness,
Good.
and understanding. And I've worked with enough families where and enough parents where it's like I've told enough parents, this is not you. I don't know, I think I was able to see it a little bit clearer. And, when
That's amazing.
the fact that we could also just, identify both, and my husband is not a mental health professional, and he
Right.
was like, there's like no doubt. She, she's still like this, but now she has her brother. She needs attention like all the time. Um, and during homework, it's like, or even when I'm reading her a book, it depends. If she's like so interested in the book, it's better. But during homework, it's like her brain is everywhere. But I can relate to her, I'm similar, and we're not a very good match because we'll crack jokes or
Right.
be silly, and then the work doesn't get done.
Right. That's amazing though, in the ways that you are able to relate to her, you are able to create an environment for her that will be able to reinforce those skills that she needs in order to move forward successfully in life and properly better understand herself and hopefully help regulate herself as well. But I'm sure it's a really nice feeling to grow up understanding yourself, right? As opposed to maybe that's something that you didn't experience yourself. You had to kind of grow into that and study that and then be like, "Oh my God, I'm in a book. I'm reading myself in a book."
Yeah, yeah. So when I
Yeah.
got my diagnosis, I was 33, and I'm 35 now, so it's very recent.
Very recent.
Yeah, but I went out and I went to talk to spoke to one psychiatrist. It wasn't a good fit, but he did prescribe ADHD medication. He was like, "I can see why you think you have ADHD." And then I went to see someone else who was in person.
Okay.
But yeah, the other thing that kind of held me off was no one believed me. Like when I would say, I think I have it, or well, I was going to say like with with my daughter, like, where did she get it from? I would say she got it from me. Obviously. And they would be like, you don't have ADHD, or like kind of like I'm faking it. So I can relate to other women when they feel invalidated, and I definitely get defensive. Like I remember when I went to see the second psychiatrist, who I still see, and he's wonderful, but I'll never forget this one sentence that he said to me when I walked into his office, and I said, hey, I think I have ADHD, and I tried out this medication. I'm interested in trying this other one. And he said to me, like, it's interesting that you think you have ADHD because you somehow got a PhD. I know.
Well, I think that's a huge misconception, right? And I will definitely get into that because that's a topic that I wanted to talk upon, but continue.
Yeah, but anyway, what I was going to say is that a lot of even qualified, intelligent professionals out there just don't know. I've even been in situations where my client, who I had seen for 2 years in therapy, like maybe I'm trying to think, okay, she came in and initially got testing and everything. And it was like the diagnoses were generalized anxiety disorder, like I said,
Hmm.
and persistent depressive disorder, which is also very common, I think, for girls with ADHD. Persistent depressive disorder, in case no one knows, is there's different types of depressive like diagnoses. And persistent depressive disorder is like more constant. It's kind of like what it sounds like, and it could be like low mood. It's not like you're completely debilitated like major depressive disorder. And basically the recommendation was, because she was being tested for ADHD, because they thought maybe she has ADHD, and the recommendation was for her to go to therapy, treat her anxiety and depression, and if she's still struggling, then bring her back and get her reassessed for ADHD. So she sees me for a year, and we're all families on board. I agree, this girl has ADHD. And so we send her back. Okay, we did what you said. And I did a consult with the psychometrist, like the person who was doing the testing. Okay, yeah, that makes sense. And then the results come back, no change. GAD and persistent depressive disorder. It's almost like, even though her scores were like borderline, like it totally could have been ADHD. But I think what's most important is that this has been now 2 years that her family, she and I all think she has ADHD, and still a professional will say, no, she doesn't.
And why do you think that is? Why is there such resistance to accepting this diagnosis and changing it to fit what are, I mean, what people are dealing with today?
I think it's like, okay, there's a few different possibilities. Each person is different. There's ego involved. It's like if the person who originally gave you a diagnosis has to look at it again and say, hey, I was wrong, That's one possibility, just to be completely like transparent. So sometimes I recommend, especially after this experience, I'll say go to someone different and get a second opinion.
Yeah, that's something that I saw in my when I was working in a private practice as well. It was the ego would get in the way, and it was, I would work with psychiatrists hand in hand, and then I would see the patient for years on end, and I would just say, and it's hard when you're working in a private practice to tell someone like maybe you should go see another professional, but that is something that you see as well a lot is where they do get fixated on the ego, and they're like, no, this is a diagnosis that I set, and this is what they have, period. And I'm like, but things change. And maybe that's what was presented in the beginning and made sense. But
Right.
as you continue to work with someone, you really do, you see different layers.
Exactly. Yeah. Yeah. But I think, like I said, like everyone's different. Maybe this wasn't the case, but it could be. It could
Hmm.
be the case. Actually, this isn't the only case. Now I'm thinking of another one where it was very similar, but the parents insisted. They were like, we're going to the same person. And I was like, but she didn't even do the testing correctly the first time around. Like she just gave questionnaires to the teachers. That's it.
Right.
And if you're going to do an assessment, it needs to be thorough. Like you need to give the questionnaires to the parents, to the teachers, if you want. Yes. It doesn't have to be the teachers. It could be in other contexts too. It could be in camp. It could be, I think people forget. I guess the reason I'm dwelling on this is because to be diagnosed with ADHD right now in the criteria, it says that the symptoms need to be present in two or more contexts.
Okay.
And that's a problem for girls because girls are able to, for the most part, keep it together at school. And that's why, there's this thought that girls are probably more predominantly inattentive. Maybe it's just harder for them to pay attention, or they're more like space cadets and they space out. And then that's how ADHD looks for them. But that's not necessarily the case. It's also because our brain functions differently than boys' brains. If you just think about girls in general, like
Mhm.
girls are usually more lovely to have in class than boys. And typically, there's research on this too. Boys perform better in class when there are girls in the class versus when there aren't girls in the class.
Okay. That's interesting.
Yeah, so there are like societal factors, there are biological factors that would make it harder to detect ADHD in girls, especially with criteria that were not written for them.
Right. Absolutely.
The other thing I think that's interesting that I actually think this would be more the most interesting because I haven't talked about this on a podcast before. But now there's an expert. I don't know if you've heard of Dr. Russell Barkley.
No, I have not.
So he's an ADHD expert. It's probably the most well-known one, and he talks a lot about the interplay between traumatic experiences and having ADHD. So there's like
Okay.
a chicken and the egg.
Well, can you share with me a little bit about the connection between trauma and ADHD?
Yeah. So there's something called adverse childhood experiences or ACEs. And that's kind of a way to categorize different types of traumatic experiences that kids specifically experience. But of course, this can also lead into adulthood. And so there's research on the connection between ACEs and ADHD. And what's interesting about that is that it's hard to kind of tease out what came first. Is it
Okay.
that ADHD creates greater risk for you to get into traumatic experiences? Or is it that the traumatic experiences exacerbate or make pre-existing ADHD kind of come to the surface?
Right.
And it's probably both. But I think, the argument that because ADHD is considered a condition that is like lifetime, even though in the past people used to think there was such a thing as adult ADHD,
Mhm.
the fact that we don't really understand or recognize ADHD in adults and how that uniquely presents, it would make sense that we would see it as separate or that it's just cropping up for the first time.
Right. Yeah.
But it's more likely that the adults with ADHD also had childhood ADHD, and maybe it wasn't diagnosed when they were kids, probably because they were very intelligent and they were somewhat successful in life. And so people maybe didn't, or professionals didn't detect it until later on.
Right.
But if you think of it, like if you already have ADHD and you're impulsive, then you're more likely to get into risky situations, to experience accidents like car accidents, lethal accidents. I have friends who have fallen down flights of stairs. Um, you know, some stuff is hard for me to talk about, but got into like lethal accidents because of issues with regulating their behaviors or being clumsy. Because if you even look at, brain structure and functioning in individuals with ADHD, the cerebellum is less developed, and the cerebellum governs like balance and motor coordination. And if you're
Right.
clumsy, you're more likely to hurt yourself,
Hmm.
or to um, end up, you know, in some kind of like a traumatic experience, whether you're experiencing a TBI, like a traumatic brain injury, or it's just an experience where you're in a riskier situation and then you experience trauma as a result. But there is research also on mortality,
Okay.
and people with ADHD tend to live shorter lives. And that probably has something to do with that too. Like if you have ADHD, think about it. I know I don't work out. We tend to be more like sedentary. We don't really work out. It's not something I'm proud of. I just can't get myself to do it. It's also hard to add it to my schedule and to actually
Right.
commit to it. And, everyone talks about like, decision or analysis paralysis or, ADHD paralysis. It's like we sit there and we think about putting on our shoes and going outside and doing the thing. And it just seems really big. And then we just don't do it. So we don't really exercise, our sleep sucks, our eating probably stinks too. And then if you take stimulant meds, it's probably even worse. Like I would say if stimulant medications have any like risk associated with them, it's probably just that your appetite is suppressed. And when you're kids, that can affect your growth.
Hmm.
But aside from that, they are the most well-studied medication, psychotropic medication on the market, and they're highly effective. And there are a lot of positives about stimulant medications, even though the media, for the most part, will try to convince you otherwise.
Yeah, absolutely. What are some of the misconceptions that you've seen with, I know we've talked a little bit about this, well, throughout it a lot, actually, it's come up, especially for women and girls in particular, the misconceptions of ADHD diagnosis. But can you tell me, as an adult woman and even in motherhood, how are some of the ways that ADHD can be misconceived within motherhood and in adulthood?
From the angle of, diagnosis in your children, I think a lot of moms are not familiar with the way that ADHD could look in girls. Actually, I just joined this committed partners program of an organization called Find the ADHD Girls that was created by Cynthia Hammer, who also published a book on ADHD. And her goal is to help diagnose young as many young girls with ADHD to catch it, and as many young girls as possible. And so she has like resources on her website, and it's specifically targeting trying to diagnose girls like as young as 7. Yeah. So I think it's just the misinformation, misunderstanding. So a lot of times it's like they don't know that ADHD could look that way in girls. I think for the most part though, what I've experienced, I don't know if it's just like the group of people I'm seeing, they seek me out and they know that I specialize in this. So for the most part, like when I see like families who are bringing like a young girl, it's usually like we think she has ADHD, but the professionals won't diagnose her. And it's because at school, either she's like
She does well,
doing
and
a
she
good job, yeah, they'll say that, well, she looks like depressed or sad or anxious. And so that's probably. And, to answer your question previously, I forgot to say this before, but you said, why do you think it is that mental health professionals are, not changing the diagnosis or not diagnosing ADHD when it could be ADHD in females? And so, yeah, ego could be one reason. If you diagnose someone with ADHD and then let's say they go somewhere else and they say, no, we don't think you have ADHD, that's damaging because ADHD is considered, like a lifelong condition. And
Right.
It's not like depression where it's like, oh, you're struggling with depression. It's okay. You're in remission. You're not depressed anymore. Like, it's not like,
Got
oh,
it.
your ADHD is fixed.
So you're saying people, professionals, don't want to bring that label in right away because they're afraid that that label will then follow the person for forever if it's not correct.
Yes.
Okay.
They want to be conservative, make sure it's really ADHD and it's not anxiety or depression that's making the girl distracted. The other thing is, I guess, there is the stigma associated with stimulant medications, and there's a lot of misinformation. Even psychiatrists, I remember that I've consulted with, I've been shocked, like how hesitant they are. Even though the girl has an ADHD diagnosis, they'll be like, well, let's start with this and let's, start with that. And then we've been now months, and it's like, let's just introduce a stimulant, but they'll say,
Yeah, why the hesitation then if the diagnosis is already put on there?
because they're misinformed. It's just like with hormone replacement therapy, like even I was just looking actually at I don't know if it was a discussion forum or maybe it was on Facebook or something, but someone mentioned like hormone replacement therapy for perimenopause. And someone wrote like, oh, my doctor said that causes breast cancer. And that's misinformation because there was this one article in the media that highlighted this very one specific finding that was not generalizable that ended up being wrong. Like, it doesn't cause breast cancer for everyone. And even for people who are at risk, the risk, like the percentage, is low. And it's the same thing for stimulant medication. There's spooky stories where people say that it causes like cardiac arrest or diabetes, health related issues, anything they can psychosis. I've seen even anything that can go wrong, like it's associated with stimulant medications. But when you look at the specifics of whatever study they're citing, maybe it's a really small sample. Maybe it was one study from several years ago. Maybe it was one study, but then there was another study that trumped it with an even bigger sample of like millions of people where they showed that maybe like a small, tiny, tiny percentage of people, but it's as much as the risk of someone who takes an aspirin, you know?
Right.
So there's people who exaggerate, and then that scares people because they would rather be safe than sorry, but they're misinformed.
There's that misinformation. Something else that I've also seen a lot are parents that are really afraid of having their child diagnosed with ADHD because everyone is very quick to say ADHD like way too freely with a child that maybe won't sit still or is having trouble focusing. But I think that there's also a fine line. You have to look at the child, the environment, and also like what is age
Yes.
appropriate? What
Yes.
is age appropriate, right? So
Right.
you have to look at all those factors. But I am seeing that there are a lot of people that are afraid because they think it's a new fad. Like everyone has
Right.
ADHD now, so we're not going to properly assess, um, like you were saying, be out of that fear of it following them for the rest of their lives. Are you seeing that as well?
Yeah, or maybe, well, not really actually, because when parents bring their kid to me, they know I specialize in this, and it's
Right,
because they have a suspicion that their kid has ADHD. The other thing is, I've had people who said, "Well, I disagree." And then I say, "It's okay, you can disagree." And then, like a few months later, we might revisit the converse. Like I give it time, and
right.
at the end of the day, if it's a kid, like the parent's responsible for the kid and the parent can make the decisions. And all I can do is just give them my professional perspective.
Right.
I can't force them to
No, of
believe
course.
something.
What is some practical advice on managing ADHD?
I think knowledge is power. So if you educate yourself and it's funny when I say that, people get nervous. They're like, they're going to educate themselves in the wrong way. But know how to educate yourself. Like I would say, like when you're looking at a book, for example, look up the author and see, what does the author do? Are they a professor? Do they specialize in this? How long have they been in the field? That's what matters. The same thing goes for like, which website are you reading this on? If let's say you read a book by Dr. Russell Barkley or Dr. Ned Hallowell or Dr. John Rady, and then you're like, and they're well respected ADHD experts, then you can look them up further and see what research have they done, and specifically look at Google Scholar. Or Dr. Russell Barkley has a YouTube channel. I think that's how you can get your information. So, yes, it's okay to self educate. Just make sure that the person, the source you're getting it from,
Is real.
credible. Yeah, and reliable, that you're not just listening to any Joe Schmo because they're relatable and they have 100,000 followers. Sorry.
Right. Yes.
Yeah.
It's
So
the truth
it
though.
is
That is the
true.
part that's part of being self-aware is where are you getting your information from? Can you trust it? And self-educating is so important, right? What other advice can you give people that are struggling with ADHD and maybe haven't seen a professional yet or don't have the diagnosis and have been struggling with that their whole lives?
Yeah, and then also I would say like find someone who understands ADHD, and just because it says like if you go onto Psychology Today, because that's how most people find a therapist, and you see that it says ADHD on their list of conditions that people they work with, like it doesn't necessarily mean that they specialize in it or that they know anything about it. So one little trick I like to teach people is I recommend that they ask the therapist like, what books about ADHD do you recommend? Or what resources about ADHD do you recommend?
Right.
And then that's a nice little trick. And then you can look it up. Look up the books that they recommended. How old are the books? Who wrote the books? And if they can at least do that, then they must know something about ADHD. And then I would say tap into your spidey senses. Like if you feel like it really is helping, then great, stay with the professional. But I think a lot of times, as people, we get gut feelings and we should listen to those. So if you get kind of I don't know, an off kind of sense from working with someone, then it doesn't hurt to do research and to see who else is out there.
I love that. I do specialize in shame and what that looks like for people in general, but is there anything in particular that you see with the diagnosis of ADHD, like how that can bring on shame prior to the diagnosis or even after the diagnosis for individuals?
Yeah. So I think, I don't know, at least in my experience and from what I've seen working with clients with ADHD, the shame is more before the diagnosis. People are so worried when they get the diagnosis, they'll experience, maybe self-stigma or stigma from other people and feel ashamed of it. But in my experience, that hasn't been the case. Most people with ADHD, once they get the diagnosis, the pieces start to fall into place and the shame slowly dissipates. And I write about, I think, a really, really good example of that, of a teen. In my book, I start out with that in the first chapter. And it was a situation where she was deeply misunderstood for many years. And she was seen as like a crazy child or, a bad kid at school. And she really, really internalized that. She was ashamed, like really ashamed. And so when she got her diagnosis, it was
Good.
just this
Fresh up there, you're like,
relief.
oh, yeah,
Like,
yeah,
this
the
is the reason, like now I understand why it was so hard for me, to keep it
hmm
together. And then we can start to turn things around. So that's what I mean when I say knowledge is power. I think
it is
when you understand yourself, then you can start to work on things. And when I say work on things, I don't mean fix the bad
fixed.
things.
Yes.
I mean enhance the strengths.
And what are some strengths that you see with the diagnosis of ADHD, if there are any?
There's so many strengths. I mean, the fact that we do feel so deeply and so intensely, that lends to empathy. If we can feel emotions this deeply and we know what it's like to suffer, then for a lot of us, it's easier to connect and to relate to other people and to understand when they're suffering. I also think there's a lot of, maybe not a lot, but there are pros to having challenges because your brain kind of works in a way that's about being balanced or developing homeostasis. So if let's say you struggle with social skills or you struggle with paying attention, doesn't necessarily mean you're dumb, because then maybe your resources are being devoted to other abilities.
Right.
And so maybe you're more creative, maybe you're more open minded, maybe you see the world in a more observational way, you notice more things around you. But then that doesn't come with associated challenges. If you're more aware, then that could be hard too.
Right. Absolutely. I only have my master's in social work. And so when I was in grad school, obviously, like we learned about ADHD, but I don't specialize in it. I don't hone in on it. I don't know that much. Like I would never say I'm confident at all. I know like the basis, right? I've had clients that have been previously diagnosed when they do come to me, and I try to educate myself as much as possible on how to like help them. But when processing their emotions and how to embrace their shame, because that's a big thing that I like to hone in on and focus on. But I really was drawn to you because I always like to learn and understand more. And I think that this is something that has been coming up a lot in my personal life with people around me. And when I saw your page, I was like, I have to know more. So I really appreciate you taking the time to talk to me and to educate my viewers in the future.
Yeah,
That's
of course. You're so
awesome.
sweet. I think you did a really good job.